Hi everyone, and welcome to another episode of Let's Talk Risk with Dr. Naveen Agarwal. Each week, we talk about a topic related to risk management of medical devices in a very casual and informal way. This is not a webinar or lecture. Rather, our goal is to talk about key topics and challenges in a very informal way and share best practices. I'm your host, Naveen Agarwal, and I'm the principal and founder at Achieve, where my personal mission is to help you achieve success in risk management. My guest in this episode is Corey Johnson. He is a managing partner at Bold Insight, a specialty consulting firm providing services to medical device industry in human-centered design and human factors engineering. Corey has a lot of experience in this area, so he's the best person to talk to about challenges and opportunities for human factors engineering in medical devices, especially now that AI, ML, and software is becoming a key part of medical devices. We had this conversation as part of our weekly Let's Talk Risk series on LinkedIn in front of a live audience. You're about to hear a recording of our conversation. So sit back, relax, and enjoy the show. Hi, everyone, and welcome to our weekly Let's Talk Risk conversation. I'm so excited to see all of you once again. Guys, it's a very informal and casual conversation every week, and our purpose here is to talk about a topic of mutual interest. But we don't go too deep. It's not a webinar, it's not a lecture, it's more of a conversation. With that, Corey, I'm so excited to welcome you and can't wait to have this conversation about human factors engineering in medical devices. Welcome.
Thank you, Naveen. Thanks for having me. I appreciate it. And to Naveen's point about being casual and informal, I am in the airport right now, so apologies for the background noise. Hopefully it's not too bad. I am the managing partner and one of the founders of Bold Insight, a human factors and user experience consultancy based largely in the Chicago area. We've been around for about 6 years, but the folks that I founded the company with, we've been doing UX and human factors consulting together under different banners for about 20 years, more closely. So that's just a little bit of background on me. My background is human factors psychology. I have grown our focus on medical device human factors over the course of the last 15 years or so, since the most pertinent FDA guidance came out back in about 2011 or 2012.
Yeah, so Corey, funny that you mentioned that your background in human factors psychology, and I think you have a master's degree in this, right?
That's correct. Master's degree in human factors psychology from the University of Idaho.
That's interesting because I never thought there was a degree in human factors and psychology. So I'm very curious personally. Tell us a little bit about what it was like and how it helped you in your career as a human factors engineer and researcher.
Yeah, it was a little harder to find, honestly, back when I was getting my master's. There weren't that many programs out there, and I certainly didn't know it existed when I was going to undergrad. I was taking psychology courses and I was majoring in psychology in undergrad because I liked the content, I liked the topics. It was interesting to me, but I knew that I didn't want to be a healer. Nothing against healers, I just didn't want to be one. So I explored other things I could do with psychology, and I stumbled into an internship. It was actually at Daimler Chrysler, back when it was Daimler Chrysler, with the human machine interaction group. So I was doing automotive UX. That was my first introduction to user experience, human factors, human machine interaction. And I did that internship for a year, and I decided, yep, this is it. This is what I want to do. And so I went back to grad school and got my master's in human factors.
Fascinating. So, let's fast forward. You have achieved your degree, you have done a little bit of work, and now you transition into medical device industry. So coming into this industry, what do you notice from a human factors point of view, which is kind of strange or interesting or challenging for you?
Well, the one thing about the medical device industry is that the kind of current environment that we're in and that we have been in for the past decade and a half or so is that the the human factors and kind of user-centered design and user experience activities in the industry are being driven by a regulatory imperative, which is good. I mean, it's a good thing that the FDA is regulating human factors to the extent that they are now, and that action has caused a drive for more attention to user-centered design, user experience, and human factors throughout the entire product development process. It also has a side effect, or it has an effect that there are instances where manufacturers of medical devices will review the relevant regulations and documentation and guidances and say, okay, the regulation says I have to do X, so I must do X, and I must conduct a human factors validation study. And so they think that is the one thing that they need to do in order to check the human factors box in order to get their product cleared. And that can be challenging because what is lost in the details of that is that there's a lot of lead-up activities that need to happen throughout the development process in order to make that validation study for human factors successful.
Yeah, so it becomes, you are saying it becomes more like a checklist type of an approach. And, on one hand, it's good that we have regulatory interest and awareness. But on the other hand, we can take it to the other extreme that it becomes like a checklist. So I can totally understand that, because in many ways, in my experience, I've seen risk management also to be treated like that, as a checklist activity. So my question there, let's get into that, is, why is it so? And what are the barriers that are preventing us from integrating these type of very important activities early on in our development process? What is happening in our organizations that is preventing us from doing that?
Well, I don't think anybody listening in would be surprised to know that the barriers are budget, timeline, pressure, all those things that factor into these decisions. It's a balancing act of trying to figure out what you need to do, what you want to do, what you have to do. And hopefully the recognition is increasing that it is less costly from both a money and a time perspective to invest in actually embracing a user-centered design philosophy throughout the development cycle, such that your validation it does become a checkbox. That is, we know this is going to be successful because we've already attended to all these things throughout the development process, not just this is something I have to deal with at the very end of the process. Let me just go ahead and try to cobble that together before I submit, and hopefully it works, because that just costs more money and more time, because it delays commercialization, it increases budget, you have to redo it.
Yeah, for sure. And the way I see this personally, Corey, and I would love your opinion on that, is, I'm in the ISO 14971 world and the risk management world, and I see as very early on this requirement to look at reasonably foreseeable misuse. And I see the connection of human factors engineering with that aspect of risk management. And all of this analysis needs to feed into our design inputs, is it not? And I think that is where I see sort of a more direct connection. I just want to confirm that with you, if that's a good, right understanding.
Yeah, absolutely. Yeah, there's a specific graphic in ISO 16366 that depicts the kind of synergy between 14971 and the human factors engineering process, and where human factors plays into that process and how you define things. And that is absolutely correct, that reasonably foreseeable misuse is something that needs to be accounted for from a human factors perspective. I mean, that's the human part of it. So everything that we assess from a human factors perspective assumes that a system operates as it is intended to from an engineering perspective.
Yeah.
The system operates correctly. However, if you introduce a human into that process, you need to account for more than that. You need to account for human variability. And that's what human factors is all about. And you need to design things into the system to prevent humans from being able to be things that will be disadvantageous.
So it seems to me that it should be directly linked to design requirements. And that, to me, happens very early in the design phase. So that's where I'm thinking is the most logical connecting point to bring this into design and development early on. So I want to briefly talk about the world that's changing now. We are in the software-driven world, and AI and ML, everything is coming. What aspects of these new technologies and developments kind of make you stop and say, how does it affect our understanding of human factors and what we should be thinking about? What is more important to us now in this new world?
Yeah, it's an important point. In the software world, you have to think about the fact that, if you think about a hardware device, this thing is, if it is updated and re-released to the market, there are noticeable visual changes that happen, and it takes a long time to do, and this requires retooling, remanufacturing, all these things. But with software, this can happen rapidly. You could have new versions of software coming out, and it becomes more of a question of how do you not only assess what use-related risks are presented by any changes that are made, but how do you establish a framework to identify what changes to a system warrant a reassessment? Because there's lots of updates that go out with the software that are just so trivial in nature. They don't change anything about the user interface. They don't change anything about how a user interacts with the system.
Yeah.
So how do you have a framework that kind of dictates, okay, with this change, you need to conduct a formal assessment of what impacts to use-related risk need to be conducted before you launch this to the world, versus, okay, this does not create any sort of change for the user interface, and therefore does not need to be assessed so thoroughly.
Well, I would think that I know many of the colleagues here right now on our session today are in the medical field. They have a lot of expertise. So I would think that when we are having this conversation, we are involving them. We are including them to really understand the impact of even those subtle changes that we may not think may impact the user, but what is the end effect? And the thing that comes to my mind here, Corey, is, and I'm very interested in this area, robotic assisted surgery. And it is foreseeable that there'll also be like an AI component to it in the future. So now we are thinking about a dynamic where you have, a robot, a human, which is a very trained physician, and we are in a very dynamic environment. So in such an environment, I would think that even small changes could have a magnified impact, and it'll be very important for us to build that assessment all the way to the clinical impact, right?
Yeah, they very well could. It's a good point. You have to assess what impact the changes you're making to the system have on every single user group or use case that you have for the system. And that, like you mentioned, that includes both the surgeon who's actually operating the device, the support team that's working around the surgeon, to any other care team members who are providing support in any sort of fashion, to the AI who is actually driving some of the decisions that are being made. So, yes, it's absolutely important. It's very much a topic of interest. AI and user experience, human factors is important. It's something that needs to be attended to as that technology progresses. We've written a book on it. It is something that needs to be paid attention to. Where trust and ethics are huge topics in the area, and how you present information that is generated from an AI-based source. It makes a big difference on how the human interacting with that information reacts to the information that is presented to them.
Great. So, Corey, what I will do as a follow-up is get a link to that book you just mentioned. I'll share that with our colleagues here in the show notes. But it seems to me that human factors engineering, of course, is a very specialized discipline, but it doesn't mean it has to be a separate part of our workflow. Just like clinical knowledge, medical knowledge, engineering knowledge, regulatory knowledge. All of these are specialized disciplines, but the point here is that we keep treating them as, separate black boxes. And the point here that we should emphasize here together is they need to be all brought in together early on in a very collaborative way. Does that sound about right?
Yeah, I mean, agree completely. You made a point earlier about design controls and bringing in human factors at that point. 100% agree. There is, so this is partially driven by the genesis of the human factors focus in the medical device industry being the regulatory guidance of 2011, 2012-ish, the common era of human factors in medical devices. But there's a tendency for human factors to be very closely tied to regulatory requirements and nothing else. And that is, in one sense, accurate, in that is what the FDA is regulating, but human factors are the core discipline.
Yeah.
That's about user-centered design, and that starts from go. That starts from green space. And it's not just, is this thing that has been designed over the past 15 years safe and effective for use? But it starts from, are we designing the right thing? And
Gotcha.
how do we design the thing right to be able to be used well by people? Not just safe and effective, but well. But does it drive satisfaction? Does it? These are things that are all part of the human factors umbrella.
Wonderful. So the key point to emphasize here is not just safe and effective, but also user satisfaction. And in that, Corey, I sense an opportunity to build competitive advantage for our products. Wonderful.
That's right.
Wonderful.
That's right. 100%.
So guys, I'm going to open the floor for discussion. And I know in the audience, we have a very amazing cross-section of expertise. We have medical people, we have regulatory people, we have people from different industries, and we have people who are actually specializing in human factors engineering. So I invite all of you to share your thoughts. Again, it doesn't have to be a question. It can be a perspective. It can be a challenge you have faced in your practice and what has worked for you. And we don't have to wait for one conversation to be over. You can indicate to me that you are interested, and I can bring more than one person here on the stage. So with that, I'm trying to bring Ed. Ed, you are on. Please unmute your mic and share what you have in mind.
Okay, can you hear me, Naveen? I'm in the car.
Yes, I can hear you, Ed. Thank you.
Okay. Your conversation there triggered a thought with me. Probably the most successful project I ever worked on was we had co-located the entire team in one space. We had one room that we had all of the different technologies and expertise and everything. And if we wanted to have a meeting, we just spun our chairs around, and there was a table in the middle, and we all got together there to discuss the issue. And you mentioned cross-functional, and that was the most cross-functional experience I ever had. Was when the problem came up, we just jumped on it right away and moved forward. So that's what I wanted to add.
Yeah, that's awesome. And when we work in that environment, isn't that just amazing? It feels good, doesn't it, that we are working together and we are trying to solve the same problem. So thank you for sharing that, Ed. Okay, Rafael, you are next. Please unmute your mic and share what you have in mind.
Thank you very much, Naveen. This whole thing reminded me of a saying that we had in the last organization I was in, where I actually really ran risk management. We said, because people, because ... people. Mm-hmm. To factor in the randomness that can happen with human factors. It actually came from our customer support liaison that we had on the committee, because they were the closest to it. And this got me thinking, okay, if I did this again, I might want to have an actual human factors engineer as a permanent member going forward for doing risk management, not just with FMEA and other stuff on whatever product I happen to be working on, because again, it's too important, especially to get the foreseeable misuse right. And also some of that psychology could be applied to some of the cybersecurity stuff I've been working on. So that's what it brought it for me.
That's Rafael, that's if that's pretty much the description of my entire profession, is because people, like, the amount of surprise that you get. Like, if you come watch one, if you've never been to a usability testing session before, or user experience research testing session before, go watch it. And the reactions that you see from first-time observers in the room to some of the things that some people do with some of the devices that are clearly using the devices they are not intended to be used. It happens every time. Like, that's the entirety of my career, is observing that over and over again.
So, Corey, I think I do have a follow-up question for you on this one. Then it just sparks a thought in my mind is, if we understand that this type of a skill set or an experience is missing from our team, how do we bring that forward to the stakeholders and make a case that we must have it early on and not as check the box towards end? Can you share some best practices on that?
Yeah, I can. Make a case on return on investment, and you can base that, depending on your situation, whatever makes the most sense, either on kind of an incremental dollar per cents change. In this case, I like to use like a call center example. So if you have an employee working in a call center who is fielding customer support calls from someone who can't use your device correctly, and you can make an improvement in the device that eliminates this issue by, say, 30 or 40%, whatever the number is, then you can just work that math through, and you can say, I am decreasing the number of calls related to this thing by 30 or 40%, and this results in this much savings in time, this much, all that, yada, yada, all the way through the support center. You can make that kind of a case for it. That's another kind of case. Yeah. Sorry, go ahead.
No. That's go ahead. Please go ahead. I was listening to you. Go ahead.
Okay. Another case you can make is the opportunity cost and time to commercialization, and the actual monetary cost of reconducting multiple summative human factors validation studies because you haven't invested in preparing to do it correctly. And you can make the case that, look, we can take the risk, and we can not do any of this front end human factors work to make sure that we're designing the right thing and designing the thing right, and just kind of check the box at the end of the human factors validation. But chances are that we could see results from that validation study that are going to they're not going to allow us to commercialize the device according to our timeline. Therefore, we're going to have to delay commercialization by 6, 12, 18 months, whatever it is. And we're going to have to reconduct all of these activities later. And that cost associated with that is X. So those are the two key ways that I try to motivate these activities.
I love it that you are actually helping us present this argument in a business sense. And just to add to it, Corey, I think my gut feel says that if we also make the argument that, hey, if it is simple and robust to use, maybe the adoption of our product would be even better, and we can make more revenue, right? So we can talk about both top line and bottom line. We can talk about both. Wonderful. Great. So Phil, thank you.
You presented the carrot.
Oh, great. Yes. I've come to realize through my experience that we do talk about cost a lot in quality, and it's not unimportant. But business people actually want to also hear what's in it for them. How can they make the business go forward? So let's start speaking the language of business, and we'll have more discussion on this, guys, later on. Phil, thank you for your patience. I invite you to unmute your mic and share what you have in mind now.
Yeah, thank you, Naveen. Corey, thank you for coming in and speaking on your history and how you came to human factors. Very interesting. ROI, the previous conversation we were just talking about, is one of the things that I like to talk about within the companies, and it's definitely a good point to bring. I'm going to touch on real quick on another point, and a plug for maybe in Naveen's future talk. I'll be coming on talking about this a little bit, but I work in a augmented reality realm in medical field. and in developing a system to be able to kind of have X-ray into the human body while a physician is going to do an ablation of some kind, right? And going back to the developing and as you go is I'm lucky to be able to have access to both software and hardware. And Corey, you're absolutely right. Software changes quite a bit very quickly. It can be minor, it can be major. And I'm lucky to be able to say that I have a good relationship with those individuals within the company. We have a conversation that when they make a change, they come to me and say, hey, do we have to look at this? Do we have to get some kind of feedback on it? And I can say yes or no, which helps to smooth out the process as we go.
Mm-hmm. Great.
Hey, Phil, that's great. I'm curious. What do you use to make that assessment? Do you use like IMDRF? Do you use that framework? Do you use a different framework or something completely different?
We mostly leverage Microsoft DevOps. They put in their user stories and bugs and whatnot, right? And then if they see a situation come up that is questionable, I'm watching those bugs and those user stories as they progress. And in that, we can put in screenshots of the UI. We can do actual videos of it. It's kind of difficult because it's an AR. It's a Microsoft HoloLens 2 headset that we're leveraging. So grabbing screenshots from that is an interesting feat, but it's a combination of those tools.
Beautiful.
Cool, thank you.
And Phil, you're right. And I really appreciate that you mentioned that you are going to be joining me as a guest speaker in a couple of weeks from now. And we'll have a lot more conversation about this. So thank you again.
Looking forward to it.
Andy, finally, again, very, very thankful for your patience. And first of all, I must say that I'm so happy to see you again. I hope you're doing well. And I invite you to share what you have in mind.
Yeah, thanks. This is a really fascinating conversation. Human factors is a big deal and big interest of mine. And Naveen, I'm sorry I've not been around. It's great to hear your voice again. Yeah, really, really fascinating. I mean, I don't work in the medical industry. I'm currently working in automotive, but in the past I worked in aerospace and defense and industrial control systems. I work with predominantly working with ISO 26262, the automotive functional safety standard. So my experience is around that. But the human factors for me, there's two parts of it, and it's really fascinating to think of the human factors in the use of the product. That's for me the second part, and it does rather sort of humorously it reminds me of a comment by the wonderful, sadly many years departed Douglas Adams, who said that if you want to make something foolproof, you will underestimate the ingenuity of a complete fool. and people are, and the flip side of that is, I mean, of course it's a glib comment, but the flip side of that is the ingenuity of people. And when you make something, when you engineer something and you think, I've got a pretty good idea of the whole use of this product, and you come across people doing amazing things that you didn't foresee at all, using it in new ways, and you think, my God, this is brilliant. It's really, really joyous when that happens. But the other side of human factors for me is the human factors in the engineering of the product. And when we go through the process, right from the start of a functional safety standard, and we say, okay, let's define our product. Let's define the level of safety that we need to hit. And in the case of ISO 2.6, as we identify and classify hazards, and the resultant safety integrity level then directs our engineering activities. It's the way in which we approach those as humans, because of course I'm a software guy and I'm trained in software, and that's what I do. But there isn't quite another software guy the same as me, and I'm different to them, they're different to me, and this is a good thing. We break problems down in different ways. We apply different solutions, and we have, of course, we're more highly skilled in some areas than others. And the human factors on that side of things, like how do we make sure that engineering goals are still met, that we're still developing the correct thing. And of course, the very last thing is the thing, I mean, in the automotive world at least, we deal with identifying malfunctions and what we need to do to mitigate the hazard of any malfunctions. But we don't address the safety of the intended functionality directly, not in ISO 26262 at least. And there is another document, and it's called SOTIF, S-O-T-I-F, that we reference in the automotive world, called Safety of the Intended Functionality. And mean, this whole thing is just, I'm talking quickly because I kind of get excited about it.
Yes, sure.
You add people in the mix, it becomes so complicated and so fascinating and so absorbing. So I'm really glad that there's people around who have a profession, who have this whole body of expertise around there, because, speaking for myself, I really need the help.
Yeah. And I think that is why it's good for us to kind of get together like this and make new connections. But Andy, one thing I want to emphasize that you said I heard really nicely from you is we can think about human factors engineering to innovate in our process design also, of way of doing things, way of developing new products, way of producing parts can be human factors. So I know, guys, we're running short on time, but I never say no to people who raise their hands to join us. Kelly, you are next. Please tell us briefly what you have in mind.
Thank you. I will be brief. I have learned so much in this, and the comment that I wanted to make is it seems that despite all of the learnings that we share, that the very simple act of beginning at the beginning holds true for human factors as well. Mm-hmm. And what I'm struck by is there are so many frameworks that are out there, and that even in the iteration or the ideation phase, that we're not thinking holistically, right? And we're not beginning at the beginning with all of the requirements that we know we need to consider. And there's so many frameworks that are available that can be used as overlays. And at the time that it takes to start to tie that back to, for example, like a trace matrix, it's so valuable to do. And it makes, we've talked about all the things that type of planning does from an ROI perspective. But what it really does is it extends or can extend the life of the design. And it can really help, right, with the life cycle management in ways, especially in software, because we can begin to consider the things that, kind of the known knowns. And really focus in on those things, especially in AI, where we need to spend more time. There's more risk there are more potential issues. And we can focus the time that we have in the right way.
Great point.
And if we would bring those frameworks forward, right, especially with cyber, and start to thread those together, it just helps us to maximize the resources that we do have. Yeah,
excellent point. And one thing I will say, we don't have to do it alone. We can get help, build relationships, collaborate with people. So that's the whole purpose of these conversations too. Roger, you are next. Thank you for participating, and let us know what you have in mind briefly, please.
Sure. Coming at this from the mechanical engineering background and in good product design, Corey, you had mentioned early on about how eye-opening it can be to watch a usability test session. And I thought, oh boy, that's a great way to make my peers more aware of this and kind of drag them kicking and screaming into paying more attention to this. So I did my own quick little search on YouTube, didn't find much there. Everything is software pointed at software, pointed at eye tracking, all the kind of the new things. But I was wondering, do you have some things you can point me to actually see videos of some of these training sessions? That was my request.
I hear your ask, Roger, and I will tell you something. I don't have that for you, but even if I did, I would tell you it wouldn't be adequate because all of the usability test sessions, these are all proprietary, of course, obviously, right? Like, no company wants their dirty laundry to be aired with people messing up using their device out for everybody to see. So obviously, these are all proprietary. However, even if they weren't, I will tell you, and I mean this as no offense to the engineers on the line at all, but even if they weren't, I will tell you that if I was to direct everyone to publicly available YouTube videos of usability test sessions gone wrong with individual products and devices on the internet, the responses from internal development teams would be, oh, yeah, but that's the other device. That's not our device. I paid attention to how to design for the user. They didn't. And I get that perspective. I really do. I understand where it's coming from, a good place. I understand that. But there is no replacement for actually deploying your potential product and watch actual people who are intended to use it use it. Weird things happen. Not be disappointed.
And I'm a believer. I'm right there with you. It's just so few design engineers ever get the chance to do that. It comes back as anecdotal stories. And as I say, I'm constantly looking at my peers trying to generate more interest in this. So
Yeah.
anyway, thanks a lot. This is a great topic.
It's a process. Thank you. Guys, we're running really short on time, and I'm respectful of Corey. He might have a plane to catch soon. So, Alex, you have the last word. Please be brief.
Thanks, Naveen. I just wanted to talk a bit about AI and machine learning and usability. I was having a conversation with someone who's looking at AI and applications, and started talking about the risks involved, and I started talking back to him about a structure of perception, cognition, and action. And he was quite surprised because he hadn't thought of it in that way, but really it came down to not just the human factors, but the usability standard. How is the machine perceiving things? How is the machine recognizing things? How is it acting on those things? So I think that there's real opportunity for people who are engaging in AI and in machine learning technologies, both inside and outside the medical space, to think about it from the human factors perspective, and maybe think about it more as usability as opposed to human factors.
Got you. Thank you, Alex, for that. Guys, I'm going to give Corey just a couple of minutes to collect his thoughts and share 2 or 3 key points we can take away with. In the meantime, I'll just share a few announcements with you. First, mark your calendars for next week. We are going to have a conversation about how to foster collaboration between QA, RA, and engineering functions. Collaboration is a big theme for us, and we want to learn about challenges and best practices from practitioners in the field. So show up. The announcement has gone out today. You can indicate your interest and show up. But mark these events on your calendar. At 11 a.m. Eastern, we meet every week. Okay, and if you miss one of these events, the recordings are going to be available on the Let's Talk Risk website. The link to subscribe to Let's Talk Risk is on this event page. So go ahead and check it out and sign up. It's free to sign up. You don't have to become a paid subscriber. 70% of the content on the Let's Talk Risk website that I produce every week is free for everybody. So become a part of our community and show up. Participate in these conversations. You have a lot to share. And if you want to raise your hand and be a guest speaker in a future conversation, just reach out and let me know. With that, Corey, thank you so much again. And I invite you to just share just 2 or 3 key points we can take away with us today.
All right. Thank you, Naveen. I think it was a great conversation. I think what I would want to leave everyone with is the regulations that have driven the proliferation of human factors activities in the medical device field are great. They have encouraged the right kind of activities to ensure human-centered design, that they can bring with them the risk of focusing just on checking the box and doing the one count of ethical regulation outflow, which is what it requires. And I encourage everybody to dig deeper and understand what is required to go into preparing to do that successfully and embracing a human-centered design process throughout the product development cycle. To Alex's last point, I think that this touches on a larger topic on what is the difference between human factors, user experience, usability, customer experience, all these things. This is something I could elaborate on for hours on end. So if anyone wants to have a follow-up conversation on that, I'd be happy to.
Thank you, Corey. And really, I actually encourage all of you to make new connections. Reach out to people. Don't spam them. Be respectful, but reach out and make new connections. That's another reason why we are doing these conversations every week, to bring people together. With that, guys, thank you once again, Corey, most of all to you, giving us your time. I know you are traveling. I wish you a safe trip ahead. Thanks to everybody who participated in this conversation, and thanks to all of you for showing up. Have a good weekend, guys. I look forward to connecting with you once again next week. Bye-bye.